Hi, I'm Dr. Sonia Doherty, and this is Dr. Krista Doherty, my sister, and we are here today to talk to you about the second part of our Burnout series, which is sleep. We decided to do the Burnout series of videos because our patients are feeling the impact of 3 years of incredible levels of stress. And so lots of people aren't sleeping, lots of adults and kids, teenagers, and we want you to reach out for support. And we want you to understand how important sleep is for your overall mental health, reducing inflammation. And if you have any sort of chronic concern, sleep is essential to keeping your body headed the right direction so that you can help deal with, whether it's chronic Lyme disease or autism, pandas, arthritis, anything that you have going on. Sleep is essential to your treatment because you can't get one part of your body better if you're not sleeping.
I'm just going to share a little presentation with sleep, but what I actually didn't put in, which Sonia really likes to talk about, is sleep being a part of the detoxification and the lymphatic or the glymphatic system. So the only way you can clean up your brain, your debris, your body is actually to have sleep. So it is essential for your well-being. It is something that for some people isn't automatic, and there's different issues around areas of sleep, and each issue has a slightly different intervention, a medical intervention. So the initiation, the maintenance, getting back to sleep, early morning waking, they're all actual sleep problems, but they all have different tricks to them. And sleep, there's so many things we don't know about sleep, but there are things we know that are very clean, mechanical, and they can be of service. So we know that sleep can be initiated by melatonin. Melatonin is made in the pineal or the center part of your brain that initiates and help maintain sleep. But managing adrenaline, fight or flight, the neurotransmitter and hormone responsible for stress, has to be managed if it's getting in the way of sleep. And there's multiple mechanisms that are there. But when you're trying to figure out, how is my sleep? Things that are kind of easy is if it's hard to wake up, if you wake up with too much energy or not any energy, if you have very physical things like headaches when you wake up that do kind of fade over the day but are very much like AM or sleep dependent, or even headaches requiring if there's naps happening, if you're irritable, if you're tired. I mean, less than 4 hours of sleep is technically considered torture. And so if you're not getting 4 hours of good sleep, your brain doesn't work well mechanically. If you're having sugar cravings, that's also a sign. So when you're trying to figure out, is my sleep good or bad, you can look at these ideas. And if it's just cumulative, it's cumulative where you're not getting that rest restorative, there are interventions you can do. Looking at things like your neurotransmitters, so serotonin, dopamine, adrenaline, thyroid function, your actual hormones, so estrogen, progesterone, testosterone. Those are things that if they're not as strong as they should be, they can result in insomnia, and they can be looked at. Inflammation can impact sleep. The digestive system, we know that 90% of serotonin is made in the digestive system, and serotonin will make melatonin. And then that fight or flight piece is a huge deal for stopping. The pandemic has been a long piece, and we've definitely been suffering. And it's maxed out our stress system. Nutrient levels can definitely impact sleep. Iron levels, low iron, can cause sleep deficiency. And then quality of sleep. When you're looking at the deepness, sometimes nightmares can interrupt that. So those are very mechanical things that can be looked at. Some patients will give us, Sonia has more of a pediatric patient base, but some patients will give us their sleep data on their devices. This is really good information when you're looking at quality. You shouldn't be alert all the time. That alert area, we want a little bit of REM, a little bit of light, but you do want a fair amount of deep. And if you're not getting that restorative sleep, sometimes you can actually see it on a device. They can get a little bit overwhelming if you're not seeing benefit, but then you sort of have a different strategy if you're not really getting that restorative. The organ system for making your energy system is your adrenal glands. They're little organs above your kidney, and fight or flight is made by that system. And then the other part of the adrenal glands or the stress system is cortisol. So they're two different areas. Cortisol is made in the morning and is not supposed to be made at night. That it will interrupt sleep. And fight or flight or adrenaline is supposed to be made on your decision, like if you exercise or if you're rushing from traffic. So if you're making fight or flight in the middle of the night, it will impact sleep. And there are ways we can decrease how much adrenaline your body makes or cut it up and clear it from the body. So the stress piece, the cortisol, if the cortisol curve is going in the wrong direction, instead of high cortisol in the morning to get you up out of bed, you're having high cortisol at night that interferes with sleep, that can actually be, judged. There's a cortisol testing in blood or urine, and then we have an in-house Konigsberg test that helps us determine what the stress system is doing mechanically in the system. And then again, the digestive system is where we want to make sure we are making that nice strong serotonin, because serotonin will make melatonin. And if the digestive system is inflamed or constipated, we're not going to have the literal amount of serotonin we want in the body. Serotonin makes us happy, but the melatonin piece is the domain, or the kind of the king of the sleep. And when we're looking for things for sleep, we all sort of have our favorites or things that will help. But the body will need things like, where's my little guys here? Do you have your favorites right there, Sonia? I like this guy, Sleep Calm. There's a bunch of herbs in here. There's a combination that we have that has lavender in it. And Sonia talks about those lavender burps. I don't like them, and Sonia finds them fine. There's combinations that we use before bed called Relax Max, and Relax Max will cut up and clear the adrenaline. St. John's wort is a great herb that tells the body to make that serotonin piece. Oftentimes the early morning waking is actually low serotonin. So putting in St. John's wort before bed can sometimes lengthen that duration of sleep. And then herbs that stop the body from making adrenaline when there's too much fight or flight would be included in valerian, passion flower, lemon balm, skullcap, chamomile. Those all help the fight or flight piece, and they can be used in conjunction. So you can use things like St. John's wort and valerian. But you can also get naturopathic doctors to help you figure out what is your combination. And when you're looking at effective turnaround time, typically you do something, and that night or the next night, you're going to see changes in sleep, in duration and depth of sleep. So that's my little summary on sleep. Is there anything you wanted to talk about with sleep?
Yeah, and actually I was pulling it up as you were asking me that. So I get a lot of questions in around sleep, of course, for my population of kids diagnosed with autism. And I think it's so important for people who do have kids with autism to know melatonin is safe. Kids with autism don't make enough. Neither do kids with ADHD. Melatonin helps your child go to sleep within this sleep window. If you're a patient of the clinic and you don't have my autism recovery manual, you can email us. We'll send you that in PDF. You can also download it for free off Amazon Prime. But this sleep chart is gold, because this is when your child should be going to sleep. It's not about the number of hours, because Krista mentioned in the beginning that your brain detoxifies toxicants and inflammation when you're sleeping. So we know that in things like pandas, in autism, even Tourette's, OCD, even depression is inflammatory. All these things change the brain. And we know in autism for sure there's inflammation in the brain. So we sort of say every hour of sleep your child gets before midnight is worth 2. That's when they're going to help clear out the inflammation, the toxicants. And so you're aiming for your child to go to sleep in this sleep window. If your child's younger than 5, then they're probably napping. So we just consider them a 5-year-old, right? You've got to give melatonin within this sleep window for it really to work. So if your child's having trouble sleeping, please know that melatonin is very safe and often essential. Reach out. We can send you this sleep chart and a melatonin therapy handout that helps you sort of structure the sleep with the help of melatonin. Some of our patients are coming in asking about tryptophan. Keep in mind that tryptophan can turn into 5-HTP and then serotonin and then melatonin, but tryptophan can also turn into glutamate. And so those of you who've worked with me know that glutamate is really the root of many of the autistic symptoms, the tics, the OCD, the fixations, the fear, the panic, the chaos land, if you will, if you've heard me describe it that way. So, tryptophan may not be the best fit for your child. I talked to a lot of teenagers about getting to sleep within that sleep window as well. Recently, I've been really successful with my kids trying to get them to sleep before 10 or 11, and their mood is better, thankfully. their focus is better, their immunity is better. And so I'm a big proponent of sleep. Actually, I don't know if anyone has heard me talk about this, but it's one of the big reasons I became a naturopath is I stopped sleeping in my undergrad and literally just sort of walked around like a zombie, went to see a naturopath, was given a homeopathic that worked really well, and a combination of herbs that I still use. I have, I love valerian. For those of you who may be perimenopausal or menopausal, I'm almost there. Valerian's a wonderful and safe support. It's got great literature to support, going to sleep and staying to sleep. And then I actually have fresh herbs that we can order in for you guys, where you can brew like a little tea before bed that's quite a bit stronger than the bags you would pick up at the grocery store, although those are very safe for most people. And even children can take those teas, those sleepy time teas, very safely. But you can order some herbs from us. You can brew up a little bit of a stronger, what's called decoction. And that's a great way to sort of shut that stress system down. Passion flower is a hypnotic. That's very safe. I know it doesn't necessarily sound that way. And skullcap sounds fairly ominous, but is really safe for kids. And it's an anxiolytic, so it brings that anxiety down. And then valerian is one of the very few things that can sort of shut off the stress system or the adrenaline that Krista talks about. So I'm a big believer in a healthy sleep. If you are having any trouble sleeping, reach out to your naturopath. If we are your naturopaths, reach out to us and let us help you guys get on the path to better sleep.
Thank you. Have a good day.